Imagine this scenario. You are a supervisor, maybe you have a group practice, and you have an awesome clinician. They barely need to talk to you, they are on top of things, you get great feedback about their work, and you love having them. After about 6 months, they tell you they're going on vacation, and you are excited for them. They go off. While they're gone, you get a records request, and when you go into their client's records, you realize they haven't been writing any notes. This scenario happens a lot more often than you think, and if you're a supervisor, it is not a matter of if, it's a matter of when it might happen to you. Hi, I'm Dr. Maelisa McCaffrey, founder of the free Private Practice Paperwork Crash Course, and today I am going to teach you how you can supervise documentation and review it so that you can avoid this scenario ever happening. All right, let's break this down into 5 tips that you can use. Number 1 is to actually review their documentation. So, regardless of the scenario, whether you're in a group practice or an agency, if you are their supervisor, you need to be reviewing their documentation. Review it and review it often so it doesn't become a huge burden, and talk with them about it. Make sure they know that they can come to you with questions and they know that you're reviewing their paperwork. I work with so many clinicians who have been licensed for decades and still struggle with paperwork because they can relate it back to that very first supervisor they had who either wouldn't talk to them about documentation or gave them negative feedback around it. So this can be a really critical role that you play in someone's entire career. So make sure that you're reviewing it and make sure you're talking to them about it. Number 2, one of the most helpful things you can do is to actually give people guidance. So even if you're in a private practice setting and you have people working for you and they're fairly independent, most therapists are pretty anxious about paperwork and they don't want to have to go through all of the ethical guidelines and read through regulations and try to figure out how that translates into the specific practice work that they're doing. They want you to tell them, here's a template, use it, and you're good. Now, if you don't like to work that way, number 1, trust me, your clinicians will appreciate it. But number 2, you can also have a few options for people. The idea here is that you don't want to make it a free-for-all where everyone who works for you is using different templates and feeling confused. You also don't want people to feel pressured that they have to create their own. Give them something that you know will meet whatever insurance requirements or whatever regulatory guidelines and help them out in that way. My 3rd tip is to give them definite timelines for when things are due. A lot of us, especially those of us with ADHD, need a deadline in order to get something done. And this may not apply to all of the paperwork, but you absolutely want to have policies and procedures that outline how long it takes for someone to do an intake assessment, a treatment plan, a progress note, and a case closing summary. So you want to make sure that whole essential life cycle in a clinical record is covered with when those documents need to be completed. And then you check up on this weekly. Yes, weekly. Don't let it get out of hand. Think about progress notes. If you have someone seeing 15 clients a week and you don't check up on that for 3 weeks, all of a sudden there are 45 notes that are due and likely even more documentation that's due as well. So do yourself a favor, do your supervisees a favor, and check up on this weekly to make sure that they are getting these things done. This is where if you have administrative help, they can also check up on that. Usually if you use an EHR, you can run a report, so it doesn't take a lot of time to just make sure that things are getting in. And I'm sure you're wondering, what is that time frame? What would you recommend? So for intakes, I would say within 1 week, you want to have the intake completed, the diagnosis given. For treatment plans, also within a week. You may need to check up on that if you especially work with Medicare or Medicaid. There might be other types of requirements you need to implement there. But within a week for either of those things is a good idea. For progress notes, within 48 hours of the session happening is usually what I recommend. And remember here, you're trying to give yourself and your clinicians some leeway. So if a note doesn't get in within 48 hours, but it's a little bit late, At least it's not as big a deal if they get it in within 4 days versus 4 weeks. Okay, my fourth tip for reviewing documentation is to incorporate this review as part of your ongoing supervision. So for unlicensed clinicians, you need to meet on a fairly regular basis. It makes it really easy as you talk about cases to just also review the file really quickly. And ideally, it would be whomever is supervising that case would also be supervising the documentation around that case, making sure that, number one, it's getting done, but number two, that it's getting done well and with the quality that you expect for your practice. And as I mentioned in the previous tip, if maybe you are meeting with licensed clinicians, so you're not seeing them as regularly, have someone running some kind of report or checking up on this documentation on a weekly basis so that it doesn't get out of hand. All right, this fifth and final tip, you're probably not going to like quite as much, but I do recommend that you as the supervisor review the client record every 3 months. The idea here is that it can be really easy to get caught up in those weekly notes and not see the client record as a full picture. But anytime anyone else is reviewing the record, they're not just looking at one note, they are looking at the whole record, and that's how you want to view it as well. So you want to be able to catch things like, is treatment getting off track from the treatment plan or from the diagnosis? Or do the symptoms that are being presented now not really match up with the original diagnosis given? These are fairly common things that happen to all of us. So doing a regular review makes it very easy to catch those things early on. And when you're doing it regularly, you're familiar with the case. It really doesn't take very long. I'm talking like 10 minutes maybe to do this. Now, some of this you can also outsource to administrative staff. So if you have an intake coordinator, if you have a practice manager, if you have a receptionist, there are lots of people who often are a lot more skilled at the paperwork part of things than most clinicians are. So if you have them in your practice, use their skills to review a lot of these things and make sure that things are signed, documents are completed, they're submitted, they're in the right location. That any diagnoses that might need to be updated are, treatment plans are updated, etc. A lot of that kind of thing you can outsource either to a report within the EHR or to the administrative staff on your team. And then the things that you can focus on are things like, is the diagnosis justified? Does the treatment plan still make sense? Are we still following the treatment plan? And are we making sure that notes document medical necessity? Now, my last bonus tip here is to never assume that any supervisors within your practice are actually doing this. So just like you can never assume that any clinician who comes in has had training on documentation or feels comfortable doing it, unfortunately, many of those very same clinicians become supervisors without getting that training or that experience. So make sure that your supervisors know how to review documentation and that you have guidelines set up for them to do it. Talk to them about it, talk to them about their feelings about it, and see if they feel comfortable or not. And if they don't, give them the training they need. And you can do this as a team and do it collaboratively. And I find that it's often really, really well received when you do that in a team setting. The bottom line here is that documentation is really stressful for most clinicians. So the more you can provide some parameters around it, the better everyone will feel about it. If you still feel overwhelmed about being a supervisor and how to manage documentation, I actually have a course just for supervisors. So you can check that out. I will link that below this video. Sign up and you will learn how to review documentation, how to do it objectively, how to give people feedback, how to manage the administrative aspects of a practice and of being a supervisor, and even how to train clinicians as well as administrative staff. We talk about all of that. So click below to check that out, and in the meantime, happy writing.